Hi, I'm Dr. Edwin Williams, a rhinoplasty specialist, here to answer your questions about rhinoplasty. Now, one question I'm asked a lot is about silicone and the use of silicone in the nose, advantages, disadvantages. I don't believe that silicone should be injected as on someone who has not had a previous rhinoplasty. And the reason why is that silicone, the good and the bad news of silicone is permanent. And that's also the bad news. The bad news is silicone is permanent. So if you inject a lot of silicone, now again, you can have maybe 2,000 patients that you injected don't have an issue, but there are some patients that are they're allergic to silicone. Okay, there are some patients that are allergic to silicone. So and it's also not FDA approved. So I don't believe in injecting the lips. I don't believe injecting the midface or any other areas where we have good semi-permanent fillers with silicone. And so when do we use silicone? The type of silicone that we use is medical grade, and we use it in what we call a micro-droplet fashion. And I only use it on touch-up type of things for someone who's had a previous rhinoplasty. For example, one of the things that really is a specialist in rhinoplasty that makes us crazy is when you do a perfect job and a year or two later you see a little irregularity or a little depression or a little area settling in the nose. It's basically, even with a tremendous amount of experience, now and then you get a little bit of an imperfection. To me, that's where I use silicone. I've had patients who've had previous rhinoplasty, don't want to have another surgery, but have a little depression and ask my help. And so in those kind of individuals, I will use, again, Microdroppa. And I'm going to explain that because there's a difference between putting a lot of silicone in, which I don't condone, and putting Microdroppa. Every needle, for example, years and years, every needle that you get injected with is lubricated with silicone. I don't know if you know that, but it is. So when there's a Microdroppa, there's a little bit of silicone wiped on, and that's what makes it slip through the skin easily and doesn't hurt as much. So they do lubricate the needles with that. So our body is used to getting micro-droplet. If you put in, and we call depot, you put a large amount in, there's always a potential to have, in a very, very, very small percentage of people, an allergic type reaction. And that's why I don't agree with that. But if I have someone who has just a little depression and I put just a half a drop in there, what happens is the body lays some collagen around that, and then I see them back in 2-3 months and often get a good enough correction from that. So can silicone be used in a micro-droplet fashion in the nose, even though it's not FDA approved? I believe yes, and I do as minor corrective things. I don't believe it should be used on a regular basis for injecting the nose to try to fill or bring a bridge up. To me, that is not good care for the patients. But I do use it in a micro-droplet fashion for corrective type things in rhinoplasty. So I hope that answered your question about when do we use silicone in the nose, and any other questions you have. There's a book that we wrote, I wrote a couple of years ago, Everything You Need to Know About Fixing and Reshaping Your Nose. This is available on Amazon, and all the proceeds of it do go to domestic violence. So I thank you for taking the time to watch and hope that answered your questions.